If you're experiencing frequent symptoms, I would say twice a week or more, or you're requiring frequent over-the-counter medicines, talk to your doctor about the acid reflux. Heartburn is one of the most common symptoms of acid reflux, and it refers to a burning sensation that occurs in the chest that is usually due to acid coming up from the stomach into the esophagus, causing irritation. Gastroesophageal reflux disease, or GERD, is when you frequently have acid coming up from the stomach into your esophagus. It's important to have your acid reflux evaluated because in some cases, acid reflux can go on to more serious conditions, stricturing or narrowing of the esophagus, or even esophageal cancer. In terms of diagnosing GERD, there's a very kind of typical constellation of symptoms that we ask for and different lifestyle factors, how long they've been experiencing symptoms, how frequently, do they ever wake them up at night. I also ask about their diet in general, if they've noticed specific food triggers, or if the symptoms do occur mostly after they eat, how frequently they're eating, the size of their meals, what they're eating specifically, do they lay down and go to sleep very soon after eating their last meal of the day. We ask about their weight and we measure their weight as well, or if there's been sudden weight gain recently, any other medications they may be taking, other medical problems. But to truly diagnose it, we often do an endoscopy, a test where we actually put a scope down someone's throat and look inside their esophagus to see if there are any signs of acid inflammation. An endoscopy is a great test because not only does it help assess whether there is acid inflammation in the esophagus, but it's very helpful to rule out any other causes of these potential symptoms, things like an ulcer or a hernia, for example. There are other ways to diagnose it. There's actually something called a pH monitor where you can actually measure the amount of acid that's being produced. Sometimes an upper GI series is ordered. That's an X-ray test that looks at the upper GI tract, and that's also helpful for diagnosing reflux and hernias. Some of the symptoms, things like a sore throat or a change in your voice, could have nothing to do with acid reflux. They could be a sign of another condition altogether, and you don't want that to be missed. You don't want to just sort of accept this as part of your life. You want to make sure that you're getting the correct diagnosis, evaluation, and the correct treatment.